Now, rising coronavirus outbreaks in parts of South Africa have raised fears that the country could see a resurgence. The World Health Organization says the latest increase is driven by North African countries where temperatures are beginning to fall as winter approaches. Morocco, Tunisia and Algeria are among the 5 countries reporting the highest number of new cases. Dr. Mary Stephen, who is a technical officer at the World Health Organization, sheds some light on Africa's response to this. A very good evening to you, Dr. Stephen, and thank you so much for your time. When we look at the numbers, that Africa is receiving right now, paint a picture for us as to how we are performing, I guess, in contrast to the rest of the world. Let's look at Europe. Let's look at the United States.
Yeah, thank you, and good evening. Yes, what we are seeing in Africa is quite different from the situation in the United States and Europe, but we are beginning to see some increase in number of cases, especially in Northern Africa. And the continent is still at risk. We are not out of the risk for a second wave yet. So what we need to do, despite the fact that we are not seeing large number of cases as compared to Europe and United States, but we need to stay very, very vigilant, making sure that we are testing, detecting the cases early, isolating, treating and doing contact tracing, as well as adherence to preventive measures by the general population is very important. We have a very good opportunity to mitigate the risks of a potential second wave. So we need to maximize the opportunity we have.
Africa's response to COVID-19 has been quite a phenomenon as far as the world is concerned. You will remember at the start of this pandemic, many sectors, medics, speculating that the effect of COVID-19 on the African continent would be even more devastating than what it has already been. Has there been any sort of research, any deeper understanding as to why COVID-19 has not been as drastic of a pandemic on the continent as initially expected or projected?
Yes, so there is a lot of research currently ongoing, including, of course, prevalence survey that quite a number of countries are trying to do. But from the beginning, yes, the projections for Africa did not come true. And this is not accidental. Really, there was a strong response from governments in Africa, and Africa responded very early as well. For very early from the beginning of the outbreak, the countries moved swiftly, and including implementation of public health intervention, including the travel measures that they implemented, closing their borders, implementing lockdown. This has helped Africa a lot in addition to the experience that the continent had responding to previous large outbreaks, such as Ebola outbreak, for instance, yellow fever, meningitis outbreak. It has helped the continent to kickstart the response to the COVID-19 outbreak. So this is part of the reason why we haven't seen the predictions, but of course, a lot of research is still ongoing to look at some of those factors that might have contributed to our success.
If we look, Dr. Stevens, at the countries that are now starting to pick up as far as the numbers are concerned on the continent, we're looking at South Africa, we're looking at Nigeria, we're looking at Egypt, we're looking at Kenya. What is it that links these countries together? What could be the common cause?
So since the beginning of the outbreak, people have been in and out of lockdown. Implementation of preventive measures has been ongoing. The outbreak has now become protracted, and there is this pandemic fatigue, and this is also affecting the general population, where people are beginning to relax for 2 reasons. People are tired, one. Secondly, they are not seeing this high number of cases, high number of deaths that we are seeing reported from Europe, from the United States. And so they think that COVID is somehow under control in Africa, and as a result, they are beginning to lower their guards in terms of adherence